Today, I introduce to you One Stop Health Hub. One Stop Health Hub is here to make your wellness a priority. So make sure that you always join us. You always up to us. We are here to help you and give you more knowledge and in depth about your health. Okay. So today we're going to be talking about family planning. As you can see on the screen, we have different types of family planning. You can see condoms, you can see injectables, you can see quite a lot of things, tablets, and all those things. So today we have Mr. Musulumba. Mr. Musulumba is our guest. As you can see on the screen, he he is so outgoing. He knows, he has experience, and he is currently working. So he knows on how best we can get these things done in terms of family planning. So allow me right now to welcome Mr. Musulumba. Just a little bit of music as we even wait for other people to come and join. Mr. Musulumba, how are you?
I'm very much fine. Good evening, and how are you, sir?
I'm very much okay. I'm happy to see you. I'm happy
I'm
to see
very,
you.
I'm very humbled. Very happy to
You're
see you, sir.
humbled. Yes, 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 yes. So today it's our first day presenting as One Stop Health Hub, and it's a privilege and the honor to have you, Mr. Musulumba. What are the few words that you might have to the society in terms of health? And I think I've given them a break or a brief in my introduction or in my preamble. But now, as you, I want to know and understand what might be your preamble on on that same thing.
Okay. To begin with, I'm very humbled for the program that you've set. Yeah. So I would urge people to participate in this program. It's a very much important for people to have knowledge about family planning, and I'm so humbled for me to be live on this platform to share knowledge about the family planning, and therefore I therefore urge people to participate and to pay attention so that they'll be able to have this knowledge that will help them or help someone um, in future. So thank you so much for this opportunity, sir.
Okay. Thank you so much, Mr. Musulumba, for quite quite a welcoming brief talk. And I would want to now encourage more people to come and join. Just listen to the house talk. Today we're going to talk about family planning, as he alluded in his preamble. So today we are going to talk about family planning because of quite a lot of reasons. By the end of the discussion, you're going to find out that Mr. Musulumba would have told us a lot about family planning and the importance. By so doing, we are going to be able um, to adjust and to know what we need to do. Okay. Then the other thing I need to explain to maybe just give a brief summary of Mr. Musulumba. Mr. Musulumba is currently based in Zambia and is a medical personnel, and he has the knowledge, he has the experience in everything that is needed for us to know. He works and he is proudly employed in Zambia. So I can see the smile from your side. I can see the smile from your side. So yeah. So with that said and done, I would want now to get into our conversation without wasting much of our time. So Mr. Musulumba, can you tell us what really this animal that we are talking about? We are saying family, what do you call it? Family planning is. Can you tell us what this animal is?
Okay, thank you so much. Without wasting time, I'll just go direct into the definition for family planning. So when talk of family planning, this is just the conscious decision that is made by individuals or by couples on how they will regulate the number of children they will have and how they will space these children that they will have, and the spacing of these children and the regulation of the children somebody or people would want to have. It can be done by having different family planning methods or contraceptive and so on. So that's just the simple definition about family planning. Sure, sir.
Okay, thank you for that. Thank you for that insight and definition on what really family planning is. And you have given us some highlights on what it is, and it is maybe just you say it is the way how people choose if they don't want to have babies now, if they want. But now the question will be like, how do I choose? How do I get to know? How do I choose the right birth control? Because I'm pretty sure the masses and everyone that is listening to this thing, they know, they have ideas, they have things that they know about family planning. They know how to use condoms, they know to use I know different types of implants, tablets, and all those things. So how we want to know, how do I choose the right birth control?
Okay, thank you so much. Before I answer your question, I feel it will be very much important for me to maybe go through some of the recommended methods of family planning. Okay, so as you mentioned earlier on, we have condoms, we have birth control pills, we have contraceptive implants. We also have what we call intrauterine devices. Apart from that, we also have what we call contraceptive injections, where people they go for injections. We also have what we call sterilization. Okay, so in talk of sterilization, it is in two forms. We have for female where there is tubal ligation, and in male there is what we call vasectomy. These are some of the methods. Now, when coming to your question, um, on the right, how people would choose the right method of family planning. This one, it depends on different factors. Okay, as we receive clients, there are some factors that we give for them so that they can choose a right method. Number one, it's about the effectiveness of the method. It's about how convenient is the method. Apart from that, we also look at health considerations, and as these people are coming, wherever they are coming from the community, um, they also have their own preferences. So these are some of the factors that we consider, we look at as someone is being guided on the method they would take or choose. Yes, sir. Unfortunately, I'm unable to get you.
Okay, okay, sorry,
Thank you.
sorry. Now can you get me?
Yes, you are very much audible, sir.
Okay, thank you so much. So, as you can see, once again, we are joined by Mr. Musulumba, a medical practitioner, and he is here to tell us more about health, about family planning, and he has defined what family planning is, and he has also given us the recommended family planning methods, and he has also now given us the what you call the the how part, how should we choose the birth control method. So maybe we would want to know the side effects of this birth control methods, to say yes, you have given us this to say we use the condoms, we use the withdraw, you use this thing. So what are the side effects of this some of this contraceptives?
Okay, thank you so much. Family planning, it has a positive part and it has a negative part. So when we talk of a negative part, we are talking of the side effects that people after using or taking the pills, receiving injectable contraceptives, they will have certain side effects, and one of these side effects is actually we have number of them. There will be changes in method of breeding. Uh, there will be changes where some clients they will come and complain to say, no, from the time I started taking this family planning, I'm continuously breeding or attending. Okay, it's one of the side effects. Others they will come and complain to say, no, from the time I started taking the family planning, I'm not attending. I can't see my messes. It's one of the side effects. Apart from that, others they'll complain of headache. Others they'll have increased appetite, which will lead them to have more weight. They will gain weight. Apart from that, others they will experience mood changes. Others they'll have nausea. Others they will also present with breast tenderness. These are some of the few side effects most people would have or experience as they take these family planning methods.
Okay. Thank you so much for highlighting the side effects. So that only now entails that all the things that we from where we started and where we are right now, no any just mere person can know the side effects minus just googling. So how is the effect of this tendency of just going on Google or using AI for choosing the right method? What are the disadvantages and advantages of using Google to give you the best method to use?
Okay. It is very important whenever you want to make a decision on health related issues to visit the facility. Okay, because when you talk of Google, yes, there is information that you can access from Google which can be very helpful, but again there are some information which is not approved. People are busy posting information of which somebody can get confused. So it is very important to come in person at the hospital so that you are given right information with healthcare providers, not just reading, because even reading, the way we understand things, we interpret things, the way we can get information, it's different from when you receive it from someone who is a healthcare providers. So definitely, it is very important that people they can come through to the health facilities to access family planning, not just depending on Google. Okay, there are a lot of misconception people would get from Google and so on. So it's better they have access to the hospital.
Okay, thank you for that. Thank you for that insight. Um, Thank you for that insight. But now again, how do you cancel? How do you cancel patients on the effectiveness and potential side effects of different birth control methods?
Okay, so counseling on birth control method involves a lot of discussions or lot of things. Number one, it's about effectiveness. We would counsel or tell clients that we receive about the effectiveness of different methods. Apart from that, you talk of the benefits. You need to explain to clients about the benefits as we counsel them. we are not just going to dwell on the positive aspect. They should also know to say there is a negative aspect about family planning, like side effects that we talked about. Apart from that, there are also what we call risky that are associated with these methods of family planning. We should be able to talk about them as we counsel these clients that we receive. So, in summary, we are saying during counseling process, you tell patients or clients the effectiveness of different methods of family planning. Number two, the benefits. On the negative part, or on the other side, we talk of the side effects and any risk associated with each method that you have or that is available at that particular time. So these are some of the important things we need to consider as we counsel our clients. I'm unable to get you, sir. Is your mic on?
Okay. So now I'm understanding something. The importance of
Yes.
visiting the hospital whenever you want to make a decision for this health things. Okay. So this is leading me to my next question. Can I when you said you talked about you canceling us this way, you need to understand to tell me about the side effects, the effectiveness, and all. So, can I get pregnant using contraceptions? Maybe this is me asking.
Okay. This one is a very tricky question. Anyway, so it is very possible for someone to get pregnant, to be pregnant as they use the family planning. Okay. We can say there's no method which is 100% effective. Okay. Why? Due to number of reasons, and some of these reasons, they are entirely based on clients. Okay. For example, I'll just talk about the pills, birth control pills. You give these patients or clients and you give them instructions on how to take. You find that when they go out there, they'll have a challenge, they will miss a dose, they will take the pills at a wrong time, which can lead to interruption in terms of the effectiveness of this family planning method. So you discover that someone is at risk of having pregnancy. Okay, so it is not 100% protecting, but again, it is 100% protecting as long as a client adheres to the instructions given by the healthcare providers. And the other challenge, we can talk of maybe these injectables. We give them dates to say, okay, we've given you this injection today. You are supposed to come on such a date. Okay. This client, they will stay home. They have ignored the date they're supposed to report. So you discover that by the time they come, the effectiveness is gone. All those things. They are putting themselves at risk of having getting pregnant. So definitely, this is just the response that we can give for this question.
Okay. Thank you so much for that insight. For that insight, it's really powerful, and myself, I'm really getting a lot of information from what you are discussing with us. Thank you so much, Mr. Musulumba. Again, audience, please fire us with more questions so that when you are done, we make sure that everyone is now settled and answered on family planning. No one should now have or deliver a child for like, no, this one was just for a mistake, I was not planning that. No one should do that. After this, we need to make sure that everyone on earth here has managed what to get the information that they are needed. So thank you so much again. We would want to encourage you to like, subscribe on our channels, and follow. Okay, as it's written down there. So I'm moving to my next question. From what you are saying, I have a question that I've just developed right now. um so how long does it take now for me to be pregnant uh after stopping birth control pills? Because most people are asking, no, for I'm on birth control pills. If it's just today, I stop today. Tomorrow, can I get pregnant? Can I do what? Can you enlighten that? Can you enlighten that?
Okay, I like the question. For you to get pregnant as a man. Okay, I understand. So this one, it is entire depending on the type of a method that someone has chosen. But most of the methods, fertility retains or comes back in few months. Okay, so after using the family planning, if a woman decides to say no, today I stop, I want to resume giving birth, or I want my fertility to come back, definitely it just takes a few months. A woman should be able to start delivering. Okay, so um that's what usually happens. It's just about few months, and these are some of the challenges that we usually meet. You find that someone has just received or maybe completed the period. They would want to come to say, no, me, I want to give birth. We advise them to say, no, wait for a few months, you'll be able to deliver, or maybe the fertility to come back and you'll be able to get pregnant if you are.
Okay. Thank you for that. Explanation. So now I'm imagining this woman. Nowadays, most pupils or children, they are committing abortion. Okay, so abortion might be the one that is for. I know there are types of abortion. um, they are the ones that are recommended, and the are ones that are not recommended. Those ones that are called criminal abortions, and the ones that are used, yeah, criminal abortions. So now, after committing any type of an abortion, can I now, oh, sorry, can a woman, perfectly say, can a woman get pregnant after a miscarriage?
Okay, thank you so much for the question. Um, yes, it is very possible for someone to get pregnant after a miscarriage or after an abortion. But again, there are some chances that someone can end up having issues of getting pregnant due to a lot of factors, especially when the abortion it's not well conducted. As you mentioned, to say we have got a lot of types of abortions, and this is what is commonly available in our community. You discover that people they are having abortions in the community without the knowledge of the health care providers. They will just stay home, not knowing or not knowing to say it will lead them into the complications. Okay, so remember, when you come to the hospital, we are going to treat. When someone wants to get abortion, they should come to the hospital. When they come to the hospital, we'll teach them, we'll share, we'll ask them, why do you want to terminate? Why do you want to get rid of the pregnancy? And then we advise. If it's something which is understood, reasonable, we are going to help someone to terminate the pregnancy. after termination, there are certain procedures that comes in after that. You need to give treatment, you need to clean, to remove all those products of conception, because if they do it in the community, all those things will remain in the uterus or in the womb, and they will lead to a lot of problems or conditions like pelvic inflammatory disease, which can lead to a lot of complications. This woman will have challenges in conceiving, and at the end, you find that they will still come back again to say, no, me, I'm not conceiving, and so on and so on. So, in summary, it is very possible someone to get pregnant after a miscarriage, as long as there is proper treatment, there are no complications. Yes, but if there are complications like serious infections and other complications, sometimes it's very unfortunate that someone will not conceive.
Okay, thank you for that insight. It's really powerful. Questions are coming from the comment section. Again, we are joined with Brother O'Brien Musulumba. Please keep on asking questions. I can see quite a number of questions. Please keep on coming. Prince Sarah, keep on coming. Chisenga Piri, please keep on asking questions. We are going to address these questions upon our finishing. Okay, so now I would want to ask another question, maybe parallel to what you're just discussing. Okay, how do I
Yes.
know when I'm ovulating and the most fertile? Because remember, most ladies, they tend to use what we call the natural, I don't know the thing, natural days or whatever, safe days and all those things. So I would want to know, addressing again the issue of safe days, natural methods of family planning, and again, can you please as well now what you call address how to know, how someone can know when they are ovulating and when they are fertile? How can they know?
Okay, thank you so much for this question. Ovulation usually occurs at the middle of mesocycle, okay, which is usually accompanied by number of factors. Okay, so one of the factors that is being accompanied by ovulation during the mesocycle, there are some changes that takes place in the cervical, in the cervix. So there are changes like cervical mucus. This woman will start having mucus. Even apart from that, they will start having, the body will change. Okay, they will feel, they will start having, like, let's talk of breasts. They will start having, the tenderness of breasts. Apart from that, there's also what we call basal body temperature. They will be having, the body will be having that temperature, which is ladies, they understand very sure about this temperature that we are talking about. They would feel that temperature, say, no, this is not the normal temperature that I have. They will have such experiences. Others, there are a lot of issues that comes in, even sexual drive. Others, they will have all those things, okay, which is these are some of the signs that will give this woman about to know, for them to know, to say, no, now I'm about to ovulate, or I have started ovulating, and that is the period when they need to understand, to say this is the fertile period. So definitely these are some of the factors or signs that would come in.
Thank you so much for that insight on you telling us on those things that we really didn't know, and I'm pretty sure that everyone is now aware of the issue of ovulation and stuff. But I didn't hear you addressing the issue of natural methods like withdrawal methods, safe days, and all those things. Can you please highlight on that? Because people are using it as a method of family planning, and therefore, we are having a lot of people suffering from what do you call those things like, no, I just didn't want this baby, it's just for a mistake, and all those things.
Okay.
So I don't know.
Okay. Thank you so much. And before I talk about the natural method, we have got so many methods, as I earlier mentioned. So when talk of these methods, they have advantages and disadvantages. Okay, I'll just sample. For example, let's talk of pills or injectables, where a woman, for example, these people who are not married, someone is on family planning, and then they have got a lot of sexual partners. They receive an injection, so now they know to say, because they are scared of getting pregnant, they'll forget to say, no, I'll have other infections, okay, like STIs. When you talk of STIs, this is where you find HIV, syphilis, and so on. Okay, condom, it's one of the best method, and you discover that it will protect you both sides, pregnancy and infections. You'll be protected. But people, they will complain to say, no, condoms, they they are not good and so on, due to number of a lot of reasons people they have. But otherwise, now going direct to the question, there is also what we call natural method. So under natural method, this is where we now need to talk about the withdrawal method. Apart from that, it's this one is entirely based on a woman. Okay, so when we talk of a woman, this is where now we talk of this woman. They need to understand their menstrual cycle. Okay, they need to understand their menstrual cycle. They should know to say, this is at this point in time I can get pregnant, at this point in time I can't get pregnant. In short, we are saying they should be able to track their menstrual cycle. Apart from that, the other natural method, it's about the basal body temperature. Okay, then we also have what we call mucus changes. Now, you mentioned of withdrawal method, which is one of the natural method. So this withdrawal method, this is where a lady and a gent, they are having sexual intercourse. A woman and a man, they are having sexual intercourse. Whenever there is sexual intercourse, at a certain point, a man, there will be a point where a man will need to release the sperm. So what usually happens here, before a man releases the sperm, he's supposed to withdraw or to remove the penis from the woman, so that this man can be able to release from outside. We all know to say fertilization or pregnancy takes place when there is a fusion between the egg from the woman and the sperm. Once they meet, definitely this woman will get pregnant. So at this point in time, when talk of withdrawal method, this is where we are talking of where a man, before they release the sperm, they need to withdraw and release from outside. So basically, this is the simple explanation, but otherwise, this is a very wide topic. There are a lot of things that we need, because we can pick like each method. We need to talk of advantages and disadvantages. Sure.
Thank you so much for that insight. I'm really benefiting, and I don't know how many people more are benefiting from what you are educating us. Okay, so I would want to know. Maybe you've talked about being fertility. I heard you talking about that issue. quite a number of times. So maybe this woman who is watching the video, or this lady who is watching, they're asking themselves, how does age now maybe affect infertility or family planning, or age affecting fertility and family planning?
Okay, thank you so much. Yeah, it's a very good question. Yes, age affects the fertility, especially in women. So in women, um, they experience a decline in fertility. Especially this one, it usually starts at the age of 35. At 35, you discover that most of women, they will stop attending the messes, they will stop having messes, which happens monthly. Then you find that by the time it is 40, you find that this woman will completely stop attending and the fertility has completely declined or stopped. So definitely the age, as the women grows older, by the age of 35, 40, the fertility definitely goes down. At this point in time, this woman will not be able to conceive.
Okay, thank you,
Yes.
thank you for that. Thank you for that. Now that I now know about age and fertility and all those things, this is so educational. People doesn't have this information, this education that is needed. I think we need to have this more of conversations about women, because women, they are very vulnerable, and which is now bringing me to an issue why we are talking about this. This question, it's mostly directed to you, but specifically with concern and in concern with women. How do you involve partners or spouses in the family planning conversation, and why is it important? Because we think family planning is all about women now. So I would want to know how you involve partners and spouses in the family planning conversation, and why it is very important like that.
Okay. This is a very important question, and I'm sure, or it's very important if one of the viewers, their men, their husband, it is very important for partners or the spouse to have knowledge about the family planning. Okay. So it is very important for a number of reasons. Okay. Number one, it fosters the mutual understanding between the two partners. It provides that mutual understanding between partners. Number two, even for the support. Okay. For the support. Remember, for example, this woman comes to the hospital with the husband to choose the method of family planning. Definitely, as healthcare providers, we are going to explain different methods that we have. When we explain the advantages and the disadvantages, it will be very good, it will be very nice for the two people or for the couple to decide as a group. Okay. So the husband, they will discuss which one should we pick. We have this one, we have this one. Okay. So they will support each other in decision making. Okay. So it is very, very important. Apart from that, even in sharing responsibilities, it helps them. It also strengthens the relationship between the two partners. So it is very important that husbands and women, they work together um, in making decisions or in participating or encouraging one another to use family planning. So definitely these are the some of the reasons why it is very important that men, they should participate, they should support their the females or their wives in family planning?
Thank you for that. Women out there, please, you should ensure that you do not exclude your your husband whenever you're making a decision in terms of choosing a family planning method and stuff. It is called family planning, and it's not called individual planning. So when you are doing family planning, we are doing it as what? As a family. Okay. So I'm pretty sure at churches, some churches they talk about that more often about family planning, family lifestyle. So if family lifestyle, it means you are sharing every detail. So in terms of family planning, let us ensure that we always share ideas and about this thing, as Mr. O'Brien Musulumba has alluded. Uh, Again, we are joined by him, and our time is leaving us. We are about to conclude, and before we conclude, we would want to know what role do you think family planning um, sorry what role do you think family planning plays in overall women's health and well-being?
Okay, so it's a very good question. Family planning, it's very important. It has got a very big role. It provides a lot of things in terms of health wise. Okay, so to begin with, family planning, it's a very crucial, or it plays a crucial role in the health of a women or woman. Okay, in terms of well-being. Then apart from that, it also empowers them to make choice about their reproductive health. Apart from that, it also helps, or it gives chance for a better child health outcome. It provides that. So it is very important to use family planning. Apart from that, we can also talk of education. Once you come for family planning, people, they learn, you teach them, you have knowledge about it. Okay, not whereby you just decide on your own, you go um by shops or these farmers and so on, you get family. No, come at the hospital, we teach you so that you have education, you have knowledge about it. Okay, then apart from that, the key important thing, it provides an overall quality of life, quality of good health. These are some of the key important things family planning will provide to people. Okay, it also provides, it gives chance for this woman to have to develop her body. Remember, when somebody is pregnant for 9 months, there are a lot of changes that takes place in the body, lot of physiological changes, all the organs, they are involved. So you discover that after delivering, this woman needs a chance, a period of time for them to have another child, so that the body can go back to normal. The woman can have, all those physiological changes, they can go back to normal. So otherwise, these are some of the key important things: general health, education or knowledge. We can talk of normal child health and growth and so on. So these are some of the key things that we need to consider.
Thank you so much. Thank you so much for that. I'm pretty sure I would want to leave some time for some questions in the comment section as they were popping up. I would just want to ask one last question for myself. Then maybe I will go to the comment section. Um, what maybe how do you address cultural or religious beliefs that may impact a patient's family planning decision?
Okay, so as the community comes to the facility, definitely they come from different cultures, they come from different churches, religions, with different beliefs. So this one, it calls for respect for healthcare providers. The beliefs and the beliefs of these clients should be respected. Okay, as we give knowledge about this family planning, we need to consider or respect their values. Okay, so what is important here, as they come with their beliefs and so on, we should also play our part, educating them, giving them information, the importance of family planning. Remember, we talked of health, okay, quality of life, okay, education, and so on. So we need to emphasize on such points so that these people, they make a right, correct decision. There are some times where we need to also provide alternative or options that will align them to their beliefs. And if it's possible, we can even help them to make the informed decision. At the end, what we promote is good health, quality of life, and provide knowledge to the community to avoid certain complications and poor outcome of life. Basically, these are some of the aspects that we would consider in line with the beliefs and religion of beliefs and cultural beliefs. Thank you so much, sir.
Okay. Thank you, thank you, thank you, thank you so much for quite and summarized and brief presentation. I can call it that because you managed to tell us or to discuss quite a number of things, quite a number of things in a shortest period of time. I know I would have given you the whole day, but because of geographical locations and data and all those things, there might be a challenge to the audience. So we would want to have you more and more and more and more. So before I say a lot, let's just have go to before I even go to the comment section. Let's just have 1 minute of refreshment and trying to understand how best we can go upon. Let's just sit back, refresh, meditate of the things that we have had. I thank you. So thank you so much, Brother Brian. Now we are back. Now we are back to the comments. So on the comment, we have. I would want to beam them. Okay. So we have Maita here. It said this is educational and revolutionizing how we perceive the whole theory. Let me post it. Whole theory of planning our families. Then we will go on to Prince Sarah Chalwe. Which one is the best type of contraceptives or family planning to use? Which has the less side effects? It's coming to you, brother O'Brien.
Okay. Okay. So thank you so much for that question from Sarah Chalwe. It's a very good question. Okay. So we have a number of these family planning methods. So for you to have the best one, I can't point one to say this one is the best, but if you visit the hospital, we are going to share with you different number of methods that we have. Then from there, we can decide together, we can make a decision together. Because if today I tell you to say condom, this one, you find that there are other factors that are associated. Okay. But for people who are not married, especially teenagers, the best family planning is abstinence. But for people who are married, visit the hospital. We look at any risk factors that are associated with your health and so on, and we'll be able to decide the best one for you, depending on the associated factors that are associated to health related lifestyle and so on. Thank you so much.
Okay. Thank you. Then we will go on to Sarah Piri, Chisenga Piri, powerful. She has an important question that she asked. Let me open it. Can someone who has never given birth use hormonal contraceptives?
Okay. So that question, it depends. Okay, if you are married, remember when talk of family planning, we are talking of these people, someone who has a spouse or a partner. Okay, there are some people whereby they get married and they decide to say, for now we are not going to have children up to a certain period of time. So there is no problem as long as you have a partner, you are not ready to have or get pregnant. It's possible. There's no problem. You can still use contraceptives. There's no problem as long as you are not ready to have to get pregnant or to give birth. There's no problem. You can use these family planning methods, any of them, with the help of the healthcare providers. Thank you so much.
Okay. Say, can a man know that he is about to release? And isn't it a dangerous method?
Definitely, it's a very dangerous method, and usually it's very hard to advise someone to say no, use this method, because most of people, it becomes a challenge for them to use that method. Yes, they would promise to say no, I'm going to withdraw, but when the time comes, it's very hard for someone to withdraw, and they'll end up releasing, and after some time someone will get pregnant. All those signs of pregnancy, they'll come in. So it's one of the methods. So it is entirely depending on a man. Otherwise, it's very hard. Yeah, you need to be You need to be very conscious. And yes, the question says, is it possible that someone can know? It's very possible. It's very possible that someone cannot say, now I want to release. And that's the same period when you need to get ready to withdraw.
Then the next question, I'm pretty sure you're getting answered. You're getting information. The next question, back in the days, they used to drink herbal medicines. This is from Rob Kunz van Kumaze. Herbal medicines as contraceptives. What's your best advice in regard to this in comparison with the then medical contraceptive pills?
Okay, thank you so much. It's a very good question. Yes, back then they used to use herbal medicine, and there are a lot of things that were involved during in these communities, villages, and so on. But there are danger effects, because look at these. When you come to the hospital, whatever drugs, or maybe we say methods or drugs that we give for family planning, it is measured, okay, in terms of milligrams, and so on. But you find that when you use herbal, you can't measure. It's either you can get too much, or you can even get less. At the end, you get pregnant. You get too much, you have other effects. So what is important is coming to the hospital. And apart from that, there are a lot of methods which community uses in terms of herbal. They are insertions. They would put roots and other powder things in their private parts. Remember those things, when they enter, when they are inserted, they become a foreign body, which can lead to other infections like UTI, which is urethral tract infections, and other problems. So it is very important. I'm calling out to the community whenever they want to use family planning. That's why at the hospital we have got so many methods. We have got various types of methods. We have injectables, we have got pills, we have got so many methods. So please, those herbals and other methods out there from the community in terms of herbals, it's better we come through the hospital so that we are able to share knowledge and we can discuss more, and then we also hear from your side. Yes, so that at the end we come up with the proper and final decision which will help people to have good health.
Okay, thank you so much. Again, we have him asking another question. In the society we live in, we have had stories where some teenage ladies use different contraceptive methods before they are married, while still indulging in sexual activities, and later on they have difficulties in giving birth. Does these methods have an impact on their reproduction?
Okay, so I can talk of two things here. Number one, remember, family planning, it's these are hormones. For example, especially the hormone, these are hormones. That's why you find that most of women, when they receive these contraceptives which are hormonal, you discover that there are a lot of changes that takes place in the body. So you find that you put too much hormones in the body, and you discover that number of things, like at a teen age, they are just going to use it for a long period of time. You find that when it is time for this teen to get ready, or to they need to have a child, because of all those disturbances in hormones and so on, they'll have a challenge, because the hormones, they are disturbed in the body, because again, um prolonged use of these family plannings, they will lead to different effects again. Okay, so it is very important that those people with at a right age, with spouses, they come so that we give them knowledge about these family planning issues.
Oh, okay. There is another last question. I think I'll get last question from the audience. It's really getting interesting. He asked a question to say, earlier you talked about ladies who does illegal abortion, and you said there is need for uterus cleaning, etc. However, if one gets in an intimate session with her spouse, won't this cause any harm to the male counterpart? Powerful.
Okay, thank you so much. It's a very good question. Definitely. For example, someone the abortion takes place, they do abortion. Remember, there is cleaning. If the cleaning is not has not taken place, or it has taken place, but all those product of conception, they remain in the uterus. Definitely, they will start to necrotize, decompose, and they will develop into infections. Okay, then this partner or female partner is having these infections. They meet with the male partner. Definitely, even this male partner can contract those infections. That's why even these UTI infections and so on, PID, you have to treat both partners. As long as this woman has got this problem or UTI problem, UTI infections, you have to treat both partners. Okay, so these are some of the lessons that that's why it is very important to come as partners as you come to have access to family planning, because some of the methods you find that you have to insert, there's what we call copper T. You find that if there's anything, any problem like infection develops, you have to treat both partners. So definitely, as long as this woman has got infections due to the abortion, which was the cleaning was not done, treatment was not given, definitely a man will have a problem, and we have to treat both partners.
Okay, thank you so much for that insight, and thank you for the questions. Thank you for the questions again, and would want to tell you that we have a lot of information that we have for you as One Stop Health Hub. We are going to invite as many guests as possible for different conversations, from different presentations. Today we had Mr. Musulumba joining us with family planning, and I'm pretty sure that we all have benefited from family planning today. And may really God bless us as we are going to start sharing this presentation to everyone who needs it, to everyone that is out there. What might be your last words, Mr. O'Brien, before I conclude? I conclude the presentation.
Okay, my last words to the community is that let us come to the hospital, clinics, any health centers to access family planning. It is very important to use family planning. As we come, let us not just leave our husbands or our spouses. Let's come with our husbands so that we make a right decision over the family planning. We help ourselves to decide as a couple so that at the end we don't have dispute, misunderstanding, and so on. So thank you so much for everyone who attended this session. Thank you so much. Let's keep on sharing this information. It is very important. We need to share this knowledge so that we can help people to have best quality of life and good health as we stay in this world. So thank you so much, and good night to everyone, all viewers. Thank you so much.
Thank you so much, Brian. Again, until we meet next time, on Monday we have a presentation on Monday we have a presentation on what you call it? I'm forgetting on testicular cancer. So please, all people, let us be advised. We should come in numbers so that we get the information that we need. One Stop Health Hub is there for you. Is there to preach the gospel of health, to preach the gospel of wellness, to preach the gospel of making you and your life very easy. You know, people have died not because people are dying actually not because they like to die or they are negligent, but it's all because they they do not have the information that is needed in order to prevent a certain health problems and certain other conditions that are out there. So please stay informed about everything. Again, I say stay tuned. One Stop Health Up is there for you. We love you. Thank you.